My name is Anna Cristancho, and I'm a child neurologist at the Children's Hospital of Philadelphia. I have recently completed my child neurology training, and now what I'm looking to do is really build my career as a physician scientist in child neurology. I spend about 80% of my time in lab, um, learning about neuroscience and doing behavioral studies, learning molecular physiology and immunohistochemistry to build upon the molecular biology skills that I gained as a PhD student. And then the other 20% of my time I spend seeing patients in clinic. The majority of that is a combination of general neurology clinic, in addition to learning about fetal neurology, which is a relatively new field in neurology where you do prenatal consults if there's an intracranial or some kind of neuroaxis abnormality that's found in the fetus, and then follow the family throughout the rest of the pregnancy, and then also follow them after delivery and birth to kind of help guide what consequences there are of those neurological findings. I really love what I do. And I love what I do because at the end of the day, when I decided to become a neurologist, yes, I was attracted to the interesting pathophysiology. And yes, I wanted to be able to understand the way the brain worked. But at the end of the day, I realized there's so much opportunity to really help people by expanding the knowledge of what we know. And I get inspired all the time by questions that I learned about from my patients, try to take them back to the lab. And then I really do want to bring them back to the clinic to have a better understanding of how we can treat neurodevelopmental disease, provide better prognosis for families, and just overall have a better understanding for them. Because I think one of the most challenging things, especially if you get diagnosis during the in utero period or even in the neonatal period or shortly thereafter, is sort of how many unknowns there are about everything and about which directions things might go, even in relatively common things like hypoxic ischemic injury, which is what I actually study in lab. And so I think that always keeps things really interesting. It always keeps things really clinically relevant for me and the basic science level, no matter how basic the science might be. And really kind of, I think it's the kind of thing to really build a career sort of long term because it's just an exciting field to be in. And it really is inspiring to be able to work with the families that I get to work with and also the scientists and other providers I get to collaborate with on a regular basis.